Dr. Kevin Hoffarth here. We're going to start off with our very first manager, as I call them, of digestion and assimilation. Now, this is a big topic, so I'm going to break them up into little bits. So let's start off with the most important place you can start, which is your food, and how it affects the insulin, which is involved in digestion. Let's start simple. What is a sugar or a carb? Sugars and carbs, I always put those names together. It's important that you actually get this first point right off the bat. When we're talking about foods, we're talking about eventual energy. And so when we're talking about sugars and carbs, we're talking about fruits, we're talking about potentially alcohol, we're talking about refined sugars, which is basically pretty much everything in the middle of the supermarket. So if it comes in a box, bag, or can. Complex carbs. Now, these are good carbs, okay? I don't like to use that word good too much, but these are the better carbs, but they're still a carb slash sugar. These are like brown rice and quinoa and sweet potatoes and oatmeal. And then dairy. And yes, guys, it includes cheese. I get that question a lot. Dairy, great source of protein, but also has lactose, which is a sugar source. And then finally, beans slash legumes like hummus. So why I bring these up is that every single one of these is a sugar carb, okay? They all turn into the same energy, meaning glucose or galactose or fructose. Now, why this is a problem is that if insulin is getting stimulated too often, the normal physiology of insulin should be it only goes up at times of meals and then should drop back down to a level of about 2 to 4, which is called your fasting insulin. Unfortunately, if we start to gain weight here, which is called the android distribution, or if you're eating too many carbs slash sugars, then your fasted insulin starts to rise. Why is this a problem? Insulin is a communicator to other managers in the system. There are multiple problems with this. Number one is if you're trying to lose weight, insulin is a signal to tell you to hold on to fat. So that's problem number one. Problem number two, insulin will tell the liver to produce high sensitivity CRP, which then tells the complement, which is the innate part of your immune system, to kick up. That's inflammation, guys. The next thing is insulin raises the stimulation of aromatase, which converts more of your testosterone into estrogen. For women, that means putting more weight in maybe the stomach, the butt, and the thighs. And for a guy, it can mean feeling less like a man on many levels because you have less testosterone. Not something any guys want. Insulin that's consistently elevated will stimulate HMG-CoA reductase. Now what that is the actual enzyme that's getting blocked by statin drugs like Lipitor, Zocor, those kind of drugs. Well, insulin actually stimulates that to help you produce more cholesterol. So you could either go on a cholesterol lowering medication or just reduce your insulin. So that's your choice. And then finally, to realize that insulin raises tryptophan in the brain, which then raises serotonin. Now that doesn't seem like a bad thing, but unfortunately high levels of serotonin block dopamine, which is the motivator neurotransmitter in our frontal lobe. And this is why many diabetics have motivation problems, high blood pressure problems, fatty liver, cholesterol problems, and hormonal imbalances. So guess what? I just fixed a ton of things by changing your sugar slash carbs. So what's the goal? I always recommend as a starting point, try to keep your net total carbs under 50 grams a day. Now, does this include vegetables? No. You can eat all the vegetables in the world, but be careful the ones that are quote unquote vegetables but are more like fruits, like tomatoes. Not these that are bad, and I'm not trying to get to the point that carbs are bad, but I want you to recognize how these are converted into the same energy sources that stimulate insulin. To review, very simple, guys, is to be aware of what a sugar or carb is. Number two is keep those net carbs under 50 grams a day. And three is if your fasting insulin on your first set of biomarkers or labs is above 2 to 4 when you're working with your doctor, then you need to be even better and lower the carbs even more because your system is out of function right now. It's in dysfunction. And therefore, this manager can be picked up and improved and reversed into a proper functioning format if you control those sugars/carbs. I hope that makes a lot of sense. If you have any questions, please write to me. Subscribe, like, and share this video. Each week, follow me for functional forums on learning about functional medicine, the BioFit Medicine Way. I'm Dr. Kevin Hoffarth.